HCPCS tends to be the lost and forgotten of the medical code sets, but why and how do we use it? Well, today we're going to be diving into not only the guide on how to use HCPCS, but I will tell you why it seems to oftentimes get lost in the mix. If you're new here, hey, I'm Victoria. I'm a medical coder, auditor, educator, and content creator. And if your teacher sent you here to help you out with HCPCS, kudos to them. But you should probably smash that subscribe button because I help out on the channel here with a lot more, and you're going to need this throughout the entirety of your career. Today's video is sponsored by Preppy, but more on them in a little bit. So HCPCS Level 2, HCPCS, we call it HCPCS. It's a standardized coding system. It's used in healthcare professions to report things like medical products, supplies, services provided to patients, and it is one of the essential tools in medical billing and coding. So unlike ICD-10-CM codes, which represent diagnoses, and CPT codes that cover physician-related procedures, HCPCS Level 2 codes are primarily used for product supplies, services not included in CPT codes, things like durable medical equipment, prosthetics, ambulance rides, certain drugs and medicines. A lot of schools don't cover HCPCS at all, or they do it very little, but why is that? Well, the reason is that the gold standard in medical billing and coding certifications is the CPC exam. And of the 100 total questions on the CPC exam, only 3 of them are on HCPCS. And honestly, if you've learned ICD-10-CM and you've learned CPT, HCPCS does tend to be kind of intuitive. So a lot of schools only spend maybe 1 or 2 hours on how to use it. And what happens then is students wind up complaining because they're like, oh, I had to spend $80 on this book and I only used it for a couple of hours, possibly not at all. Maybe you only did a couple of practice questions. So what happens is schools opt out to even not providing HCPCS book or very minimally for that reason, especially because codes change every single year. So if you take your classes in one year but test in the other, you oftentimes buy new books. So they're trying to give you whatever little cost savings they possibly can. So the good news is you've saved yourself some money. And then if you decide you need a new HCPCS book because you're sitting for the certification exam, like the CPC, which you definitely should sit for, I'm going to sit here and cover all things HCPCS with you. Now, I should probably start by telling you that there are different editions of the HCPCS book. So each one will be structured a little bit differently. I use the AAPC ones because I just pre-order the AAPC book bundle every year because I get a pre-order discount. So if you don't have this exact one that I do, you may have different layout and structures, and that's totally fine. If you're sitting for the CPC exam, you are allowed to have whatever edition of the HCPCS book that you want. It has to either be current year or prior year. That's all they care about. And again, there's only going to be 3 questions on the exam that pertain to HCPCS, and I use the AAPC edition, but every edition has all of its different perks and different setbacks. So AAPC, AHEMA, PMIC, Optum, AMA, they are all fine, but they each have different layouts and structures. Now, you may be wondering why the book says HCPCS Level 2 on it. Where's Level 1? Well, HCPCS Level 1 and 2 codes are standardized coding systems that we used in the healthcare industry for billing and coding. Level 1 is also known as CPT codes. So the CPT codes, they are numeric. They're developed by the AMA. They cover medical, surgical, diagnostic services performed by healthcare providers. The Level 2 codes, on the other hand, are alphanumeric. They're created by CMS, and they include product supplies, services not covered in CPT, DME prosthetics, non-physician services. The main difference kind of lies in their scope and usage. So level 1 focuses on provider services. Level 2 covers a broader range of healthcare items and services. And also HCPCS Level 2 is free to use, unlike CPT, which is very strictly copyrighted by the AMA. Oh, and if you're watching this video to try and gain some insights on coding and you're looking for a school that will help you get prepared for certification that's fully online and you can work at your own pace, I got you covered. To find out all about a career in medical billing and coding, you want to sign up for medicalcodingmasterclass.com. It gives you the full blueprint of how you can go from someone who has no healthcare experience to job ready as a medical biller and coder in as little as 6 months without overspending, without going into student loan debt, and with all kind of perks that you won't find in other institutions, such as an externship. And it will tell you about Preppy, which is the program that I endorse to have you be job ready as a medical biller and coder. Again, check it out, medicalcodingmasterclass.com. So my HickPicks book, you can see here, has a ton of tabs on it. I bought them from Medical Coding Tabs Co. I will link them below if I forgot. Remind me. These are not the tabs that come with the book. The AAPC edition does come with tabs. You are permitted to have tabs in your book for the CPC exam. HickPicks Level 2 manual is organized into alphabetic sections, and each of those sections represent a different category of supplies and services. So here's the overview. You have A codes, they cover transportation, medical and surgical supplies, and miscellaneous experimental procedures. B is for enteral and parenteral therapy. C codes are temporary codes for hospital outpatient use. E codes designate durable medical equipment. G codes are for procedures and professional services, which is confusing because you might be thinking, Victoria, that's what CPT is for, right? But these are often what we refer to as our Medicare codes. So they're used commonly by Medicare and the Medicare replacement plans. H codes cover our alcohol and drug abuse treatment services. J codes are for drugs administered other than oral method and chemotherapy drugs. K codes are for durable medical equipment and regional carriers. L codes are for our orthotic and prosthetic procedures. The M and N codes are for other medical services or supplies. P codes are for path and lab. Q codes are temporary codes for procedures and professional services. R codes are for our radiology procedures. S codes are for use with our commercial health insurance companies. We see these a lot with things like Capital Blue Cross or Highmark. T codes are for our state Medicaid agencies. There's only 2 U codes, and those are related to COVID. V is for our vision and hearing services. And that's it. The instructions for using HickPicks are not as robust as some of the other code sets. And at this point, I would like to remind you that the purpose of me screen sharing is so that you can follow along in your own book, not so that you can read every single letter of everything that is on the screen. Essentially, the instructions for how to look up a HCPCS code are to identify the service, the supply, or the equipment or drug that the provider has documented and confirmed. Then you decide which main term you're going to search in the index based on the patient's specific case. You can look under maybe the name of the service, like magnetic resonance angiography or EMG, or you can look by the supply. So is it a dialysis drain bag? Is it filler? Or the equipment, is it a bathtub? Is it a cane? Is it a wheelchair? Or the type of drug. So there is a drug table, so hydrocortisone, bromide, whatever you're looking under. Or in some cases with HCPCS, you can look under the body site involved versus CPT, so the hip or the knee, or even the type of service. So was it a lab test? Is it oncology related? Then once you find that term in the index, you note the recommended code. You start with the main term and review any available subterms. You cross-reference all codes listed, whether it is one code, a series of codes separated by commas, which you might see that you have to look up several codes to determine the right one, or it might give you a range of codes that are separated by a hyphen. Make sure you pay attention to the Index C convention that directs you to look elsewhere in the index to find the code, or the C also convention. Again, you can kind of see now where, like, as we're going through these instructions, it is similar to CPT. If you're familiar with the C and the C also and how to use an index, you're already familiar with how to look up a HCPCS code. Then we turn to that code in the tabular list. We read the full code description and look for the correct code assignment. And a little bit different about HCPCS is it actually tells you review the surrounding codes to be sure there isn't a more appropriate code available, which is unlike ICD-10-CM, which tells you, hey, find the code in the alphabetic index, look it up in the tabular, don't go searching around for codes. HCPCS, it actually does tell you, like, you can look around and see if there's a more appropriate code available. And then confirm your code choice complies with the ethical coding procedures. Never report a HCPCS code simply because it will support reimbursement from a payer. We are only reporting those codes that the documentation supports. And when we are searching the table of drugs and biologicals, which functions a lot like our drug table in CPT, make sure that you're following the unit numbers, the route, and the drug code and cross-reference to the tabular list. So much like I say for our other books with HCPCS, open up your book, start paging through it, start getting familiar with what is in there. So that way, if you're looking at a report and you go, oh, it says something about a cane or a cast. Oh, is that something I need to code? I think I remember seeing that in my HCPCS book. So when we're looking for our code, we're going to go to our alphabetic index. Let's say we're looking for a type of cast. Maybe we're looking for a long arm splint and it's an adult plaster. It's going to give us code Q4017. We're going to go to that code in the numeric listing, and here it is: cast supplies, long arm splint, adult, 11 plus years, plaster. We're going to verify if that's the correct code, and if it's not, maybe we want to look around and see if there's something that's more appropriate to use. One thing I will note is there are also a lot of additional modifiers in HCPCS. Now, in my edition, they're all listed here in Appendix B. Depending on what edition you have, they might be listed somewhere else. So oftentimes people will say, oh my God, I found this modifier. I'm looking it up in CPT. I can't find it anywhere. Where is this? It might be in your HCPCS book. So here, for example, a GH modifier, diagnostic mammogram converted from screening mammogram on the same day. Now, just because it's considered a HCPCS modifier doesn't mean it has to go on a HCPCS code. They can still go on CPT codes, because remember, CPT is HCPCS level 1. So let's practice a couple of lookups. We're going to look for a wheelchair, fixed full-length arms, swing away, detachable, elevating leg rests. So we're going to start with what? What's our main term? Wheelchair. Now, when we look up wheelchair, there's a lot of different wheelchair codes. So let's see if we can find something that's close. It didn't say it was fully reclining. It didn't say it was heavy duty. So let's go with our standard E1130 through E116. Sometimes HCPCS can be a little bit of a search and find, especially with some of these equipment things. Now, the good thing is it sounded like that code range was going to be huge, but it's actually not. It's only a few codes. So we're looking for fixed full-length arms, swing away, detachable, elevating leg rests. Here it is. Wheelchair, fixed full-length arms, swing away, detachable, elevating leg rest, E1160. The good news is that for the purposes of the CPC exam, it's all multiple choice, remember? So chances are good they might ask you a question about a wheelchair, and maybe they'll give you one that was a different type and not the standard. So worst case scenario, you might just have to kind of look up and mix and match. There's a fair likelihood that one of the questions that they will ask you on the exam about HCPCS will be related to medications, and they'll try to trick you up with things like maybe route of administration or dosage, because we might have to do a little bit of math depending on the dosage given and the billable unit, and then how many units we're billing. Now, no matter what edition of HCPCS you have, there should be a table of drugs and biologicals. Mine is in Appendix A. Yours might have it in a different appendices or located differently in the book. Oftentimes they are by the generic drug name and not the brand name. Sometimes they are by the brand name. So again, just search around, get familiar with what's in there and what's not. You might have to just use a little bit of critical thinking to think, is there another word or phrase for this same product? So let's look up Zofran. That's an anti-nausea medication. It's often given in the hospital for patients who are having severe nausea and vomiting. So we can see here that Zofran is 1 milligram and it's administered intravenously. So let's say if a patient is administered 8 milligrams of Zofran intravenously, we would have to bill 8 units because the billing unit is only 1 milligram. So in that case, it would be our J2405 times 8 if we're billing for 8 milligrams. You have to be careful because some medications have different codes depending on different dosages. So they might try to trip you up with, for example, Depomedrol. And they'll say, hey, we're giving 40 milligrams of Depomedrol. And one of the options might be to bill this twice and have that compensate for the 40 milligrams. But if they're just giving the 40 milligram dose, we have a different code for the 40 milligram dose. You also have things like testosterone. Depending on the different type of testosterone, we have different codes. And honestly, that is the bulk of how to use HCPCS. Some tips for efficient use: tab your manuals. Consider using those tabs to mark those frequently used sections or codes or your alphabetic index. You can mark your book for the CPC exam, so if you want to put little notes in your margins, or especially for frequently used things or some of those drug things that you want to pay attention to. Go through some of your study materials, and if there's concepts that you see repeatedly coming up or certain test questions, make little notes about those specific codes in your book. Now, you can't write the test question in your book, but you might want to take that concept and maybe if it's about a specific code, write a note about that code set. And of course, stay informed. Regularly review coding newsletters, attend workshops, go to your local chapter, participate in webinars, and stay informed about those annual code changes in HCPCS and the best practices. Mastering the HCPCS Level 2 manual is a critical skill for anyone involved in medical billing and coding. However, if you already know CPT and ICD-10-CM, it is not a monumental task. With taking time to get familiarity and doing some practice, navigating the manual can become an intuitive part of the coding process. The key, though, is knowing not only how to look them up, but how to apply them properly, how to understand how to apply them properly in the various clinical scenarios. Now, if you want to see a tutorial on how to tab your HCPCS book, check out this video over here. Otherwise, I will see you guys in the next video. And until then, just keep on coding on.